Awesome. We are live. So good evening. Thank you for joining us for another episode of JeffCo Health Matters here with the Jefferson County Health Department. My name is Brianne. I'm the Public Communications Officer, and this is Jeana, our Preparedness Supervisor now. Yep, Preparedness Supervisor now. You've seen us probably before. We've done some of the COVID videos and updates. So that's actually what we're here to chat about this evening as well, is our COVID numbers, our status, and then obviously we did report today that we have our first confirmed case of Delta variant. So Jeana's going to talk a little bit about that. So we're just going to jump right into it. I'm going to pull my notes up in front of me here. This week we are actually reporting that we are in orange status. We just tipped over the threshold for orange status. So that's that 7-day rolling average of cases per day per 100,000 residents. And you have to be at a 10 or over to be in orange. And we were at 10.41. So just a little bit over, but enough to obviously tip us into that. Not the direction we want to go. We're hoping to get it back down into yellow. In addition, we also had an increased percent positivity. We were looking at 9.66% positive this week, which is also an increase. So this definitely isn't the direction that we want to go, but we know that our prevention measures work, and we need to continue to put those into place, get vaccinated, social distance, wear your mask, wash your hands, all the stuff that we've been talking about for over a year now. They still apply. They're still, they're the OGs, so to speak. So we have to keep pushing those and make sure that we can kind of slow the spread, especially with Delta variant, which we also officially reported our first case of confirmed Delta variant in the county this week.
Yes.
Yeah.
So important to know that while this is our first official Delta variant, we know that it's been in our watershed. We've seen the reports. It's been all over this. We knew this was coming. It's not much of a shock. We're still sad to see that it has happened, but we know that there are most likely more cases in the community. This is just the one that was caught and tested. The Delta variant, we're still learning about it. When you look at the CDC, there are threat levels for a variant. We have a variant of interest, one of concern, and one of high consequence. We don't currently have any of high consequence that's associated with COVID-19, but Delta is considered one of concern that we're watching. And part of that is because it is so easily transmitted person to person, and also we're seeing a more severe illness from folks that have Delta that are not vaccinated. How we test for Delta, we've been getting this question a lot. The state lab,
We get a lot of those. We actually just had someone that asked that question.
Yes, so. We've actually had folks request that their test be sequenced. So how it's working in Missouri, they are doing a very limited random sampling of tests. These are typically coming from our hospital systems and commercial labs. If you get a rapid test, that's not going to be a viable option to go through the sequencing to see what the variant is. They've been doing this. We get reports of other variants as they've come through. We typically don't get results of a variant until 3-4 weeks later. So you get your test. That test is going to say positive, negative, it was detected, it was not detected. You have it or you don't. The treatment course, your isolation, your quarantine, it doesn't change depending on which variant you have. So this isn't a time-sensitive test that we have to go through to see how we're going to treat you. The treatment's going to be the same for your COVID, especially if it's not severe, if you're not in the hospital, you're going to isolate, your contacts are going to quarantine. But we are getting those limited samples from around the state that will go to the lab to be sequenced. And that's when we'll get those results from our state epidemiologists.
Yeah, and the one thing to know too about Delta variant, which like you said, it doesn't necessarily change like treatment or the way that we do investigation, but it is important for surveillance as well as just for community knowledge, because particularly with the Delta variant, we do know that it has a higher transmissibility. It comes with an increased risk of high transmission as well as severe illness. So we definitely want to make sure that people have that information so that they can just be aware and make choices to, protect themselves, their families, and yeah, I mean, we have like you said, we have an official confirmed case, but we do know that that takes time. So the chances of that being a solo case in our county are probably pretty rare. So we just really want to make sure people have that information and get their questions answered and be able to push that prevention. Definitely, for sure. I am pulling up some of the questions that we have really quick. Let's see. I know that we had one question that was about the variant and testing, and you kind of answered that one. That's not something where it's like, oh, yep, you have it and you have this variant. It's something that goes through the Missouri Public Health Lab, right? Correct. That goes through, and we've had a limited number of those tests. I think CDC said 600 and something. Yeah, I think total. So just something to kind of keep in mind. One of the questions that we had that was just about COVID, anything COVID related. So if you have any questions, drop them in the comments below. I'm looking at them on my phone. I'm not just staring at the table. So one of them we had from earlier was, are you going to force schools to put kids in mass prison again? So we make recommendations to the school districts, to superintendents based on CDC guidance. The schools also receive the official guidance from the state and as well as DESE, which is the Department of Elementary and Secondary Education. We continue to recommend that schools follow CDC guidance and recommendations. We do not force, mandate, order, anything like that. Those policies are up to the school. So ultimately the school districts make those decisions. We simply provide as much information as we can. We address questions. We sit in meetings. We are there as a resource, but ultimately that is their decision on what they recommend, what's best for their kids and their families.
Yeah, and important to remember that each school district will set their policy.
Yes.
So one may be stricter or looser on those recommendations than the other. Like she said, we recommend following CDC guidance. We're always here to help them whenever they're working through those processes, but it is up to each district and their board.
Right, for sure. Let's see. So then somebody also asked, will you be recommending that children wear masks going to school in the fall? So CDC guidance is that if you are not vaccinated, you should be wearing a mask. Particularly when you're in indoor spaces around others, especially when they are unvaccinated or you don't know their vaccination status. And that actually bridges into another question that we just got that says, should I still wear a mask even though I'm fully vaccinated? We were just talking about this morning. We were literally just talking about this morning. So it can't hurt to wear a mask if it makes you feel more comfortable and that's what you want to do. No, that's not, it's not like someone's going to tell you can't wear it. But it's the CDC still says that if you are vaccinated, that's a choice you have. Now, they also state that they recommend following local guidance, especially like in a business place. We know that in healthcare settings, you still have to wear a mask. Public transportation, you still need to wear a mask. We encourage folks, if you are not vaccinated, to definitely wear your mask. And then if you're in an area where you're around a lot of people, maybe you don't know their status, or you've been traveling and you're kind of still concerned about your own and like what you could put out into the community, you can definitely wear a mask. Like I've started wearing a mask going back into Walmart. I'm fully vaccinated, but you just never know, right? Delta variant and all the changes, it's just nothing to joke around with. For sure. Let's see what other questions we have. Let's see.
While you're looking for the next one, I'm going to go back to schools. One of the changes that CDC has put out for their school recommendation, they have acknowledged that children in schools, if they are a close contact, if both cases, the positive case and the contact, were both wearing masks consistently and correctly and fitted correctly, that they have said that does not necessarily mean they have to quarantine. That does not apply to staff, teachers, but they are looking at the kid-to-kid transmission in the classroom. And so long as they're both wearing it consistently and correctly, they have put that piece into the recommendation that they will not have to quarantine. Again, that's going to be up to the school districts to follow, or if they want to be extra cautious, that's going to be up to them. But I don't even know if it's a recommendation so much, but they have put that allowance in the new guidance.
Yeah, that's great. One of the questions we just got is, if we follow the same curve as last year with a large spike coming in this fall, what is our plan to deal with that? How will your actions this year differ at all from last year? So that's a really great question. We've actually already been talking about that as well,
Yeah.
even just in this room with Jeana and I, having those conversations. I know that that is an agency conversation that has had taken place with all of our staff members, with our admin and executive team. We're hoping that that doesn't happen, but we also know that there is a chance that it will. So we are preparing for that. We're looking at what our procedures would be for case investigations, again, continuing to provide education, not only to folks just in general in the community, but also like what we'll do for folks who test positive, how we're going to have those conversations, provide education in a timely manner, as well as continuing vaccination as much as we can, getting out into the community, making it easily accessible, getting people to the resources so they can find vaccines that are close to them. I don't want to say that we have a better idea of what we're doing because that makes it sound kind of terrible, but we have a foundation to start from, and so we're hoping that that's never anything we have to put into trial. I'm really hoping I can just write a green status press release, and that would be amazing. That would be the end of it. But
internally, we are getting ready to hire a few extra
yes.
investigators, so that is posted on our website. We have some grant funding. We are extremely budget conscious. We know that we're not alone. Resources are thin. The response, I don't know that we have the ability to have the same response that we did last year because the funding isn't going to be there. So we are looking at hiring a couple additional investigators through these grants. And we're also very aware that the other services that we provided the community, we need to continue with those.
Yes.
We went so long without almost over a year. We know that we have a lot of programs that are really important to the community, and we do not want to have to pull those back out. So we are trying extremely hard to make sure that we balance that we're still providing all of our programs that we need to, and still following up with our COVID response. So it'll be an ever-changing plan, but we are trying to balance that as well as we can.
I'm really glad you mentioned that because I honestly, that completely slipped my mind, but that is absolutely a key thing that last year we really were all pulled in for COVID, and we recognize that we do have a lot of programs that are in the community that are vital and important, that have, since we have picked those back up, even staff members are very excited to be like back in their own programs. So that is definitely a really good point. Thank you for bringing that up. We had a question. I have autoimmune issues and I have been vaccinated. Should I wear a mask? So the CDC states that if you have been vaccinated, however, if you're immunocompromised, that you can wear that mask as an extra layer of protection. We know that wearing a mask is an extra layer of protection regardless. If that makes you feel more comfortable, especially if you're in places with a lot of people, or if you're meeting new people on a consistent basis, that might be the best way to go. I can say personally that my husband has an autoimmune disorder. He's been fully vaccinated and we still wear our masks. But that's just kind of, I think we got used to it too. And I don't have to wear makeup as much, but yeah, that's definitely a personal preference, but there's no harm in doing so if that makes you feel more comfortable. The CDC has that in there, especially for immunocompromised.
And if you ever have a question, contact your provider. They know your medical history as well as you do, and they may recommend absolutely. They may let you know that your risk factor is a lot lower and where you fall on that spectrum. So make sure, talk to your physicians.
Somebody said you guys did your best to get people vaccinated. We appreciate everything you do.
Thank you.
Thank you. We appreciate that. Let's see. I also need to know, does the Delta variant, something emailed, fully vaccinated, I work in a restaurant, should I wear a mask? I'm not sure what that one question is. I need to know, does Delta variant, so if you work in a restaurant, obviously still the same policies apply if you're vaccinated, even if you're in an indoor space and stuff, obviously following the policy that your employer has in place. So if they require masks, but I would think that if that's something that you want to do, that you can continue to do that, maybe, talk with your employer and see what that procedure is. But again, even if you're vaccinated, there's nothing saying that you can't wear a mask. You absolutely still can. Let's see. Let's see. Sorry, I'm going through. I usually do this on my computer, so I'm looking down on my phone. Vaccine. Okay, so from my research, the vaccine does not appear to protect you from the new Delta strain. We actually were talking about this morning too, and we were looking up some stuff. So the studies are showing that the vaccine does protect you against all the variants that are out there as of right now, including the Delta variant. I think it's like between 80 and 90% is what the studies are suggesting. So it's slightly lower than what the
original.
Thank you. The original efficacy rate was. But I'll take 80% versus, I'll take that versus nothing at all for sure. What percentage of people in Jefferson County received the vaccines? Great question. I have that in front of me. We are sitting at fully vaccinated, a little over 30%. So 30.45, which is about 68,000 residents. So we'd like to see that number higher, but we do continue to increase ever so slightly. So we'll take what we can get.
Yeah, and if you're interested, lately in the past week or two, I've been getting a lot more questions of where can I get vaccinated? I have a family member who's ready to go. Where can we go? We have our mobile units out. If you can't find us, because I know that, we're all over the place. We may not be in your neck of the woods. Most of the pharmacies, the big box chains, are all providing vaccine. And most of the time you can walk in. Now, some of them still do prefer an appointment. But if you've been at, I'm going to say Walmart in the afternoon or evening, I've heard them over the intercom say, we have an extra Moderna or a Pfizer, whatever they're providing that day, because we're still trying to be very diligent with that vaccine and not waste any doses. But for the most part, I believe you can pretty much walk in anywhere that is a provider and get your vaccine that day.
One of the resources that I've been kind of pushing to people who've been asking that question, obviously through work and even just like family members and friends, vaccines.gov is super helpful. You just put in your zip code, how many miles you're willing to travel, and you can even specify like I would prefer Pfizer, I would prefer Johnson & Johnson, and it will pull up all the locations in that area that have that particular vaccine. It'll tell you if they're out of stock, if they're in stock, if they require an appointment, if they're taking walk-ins. We actually just had someone that popped in and was asking, and I was like, let me look it up for you. So vaccines.gov is a really great resource. Highly recommend that if you're out and about and you're just like, well, I got 30 minutes, I can get this done, find what's close to you. We actually had another question, Jeana. I'm hoping that you can answer this one.
Okay.
It says, so what about for those who are too young to be vaccinated? I am constantly exposed to everything being a nurse. Does he have to quarantine if I am exposed?
No. So, and I haven't had that question in so long.
I know. I was like, oh, wait, I think
we go back to one layer out. So we have our positive case, and everybody in that 6-foot radius for 15 minutes or more is going to be considered a contact. Those contacts quarantine, but no one has to quarantine past that line. So if I am the case and Brianne is my contact, no one in her household has to quarantine. It's going to be just her quarantining, preferably away from everybody else.
Right.
Because if she does become ill, then she hasn't exposed the rest of her household.
Right.
And we do the best we can. And we know, especially when you have small children, it's not possible to just go to your room for 14 days by yourself, no matter how much we would like to.
Say as much as you would like that.
We know that you're going to have to take care of your family. You have stuff to do. Try to limit your interactions. Make sure washing your hands, keeping that hygiene up, wiping down your surfaces, trying to be just very diligent with your disinfecting. And we all do the best that we can. But we only go one layer out on that quarantine. And if you never become ill, then that's where it stops.
Right. Let's see. Somebody had asked, what is the correct way to wear masks? So there's a really great graphic and some videos on the CDC site. If you go under your health and then prevent getting sick, there's a column there for masks. And within that, it's like a folder within a folder within a folder. But it'll tell you like how to properly fit a mask or how to find the mask that's right for you. And there's some really great graphics and step-by-step. I think that would probably be the best resource for that question.
Yeah. Reminder that you need to keep it over your mouth and nose.
Yeah, disclaimer.
I see a lot of folks over their mouth, but not over their nose.
Right.
We're looking at respiratory droplets that can come out of either of those spaces.
Right.
So we're trying to make sure that they're covered.
For sure. Let's see, what percentage of those tested positive for the Delta variant have been vaccinated? That's a great question, but I don't know.
So I do not have the answer, but I thought that the last time I looked, it was like 99.5%.
I remember that stat.
It is almost 100% if you are unvaccinated.
I printed it off somewhere.
For Delta. I don't know that we hardly see any the other way around, but if you're unvaccinated, that Delta goes through pretty fast.
And the CDC should have that information too. They have a whole section on variants, and you can find like the surveillance numbers and stuff, and then they have specifics. So that should be something that you can find on that site as well.
Yes, don't quote me on that number.
Right.
But it was extremely high.
Let's see. So, this might be a good question. I don't know if we know the answer to this one now. I know. Shocking. Here we go. So I have a family member that can't get a vaccine because he doesn't have an ID. How can he get vaccinated if he doesn't have one? Well, he can come to the health department and we can get him an ID if he was born in the state of Missouri.
I know. I wish we had one of our front office workers here.
Right.
We run into this in the clinic, and it's
usually just two other forms of ID,
right? I think
right?
so.
Yeah.
We will work with you to make sure that we can still get you vaccinated. Right. We prefer an ID, but I know that there are other options if you don't have one. But you can call our front office, and they can walk through that piece with you, and then we can get you connected with wherever the van is going to be.
Yeah, that's usually like the same concept when folks need an ID, or the birth certificate, but they don't have an ID. There's always other forms that we can take. The ladies up front have that memorized, so you can give them a call and they can definitely help you out.
Any of them are watching right now?
Right.
You can throw that in the chat.
Right.
Actually,
you want to throw that in the comment stream. That would be great, ladies. Thank you. I think I saw Joanne on here. Yeah. Shout out to Joanne. Okay, let's see what else I can find here. I know we are kind of coming up on time. We got a few minutes. Let's see.
While you're looking,
yes, absolutely.
Talk about Homebound. This is kind of a program that's been bouncing around. Some of our pharmacies have taken on this task. Our ambulance districts, it's kind of being assigned out through different programs. We are currently working through our Homebound list. A few weeks ago, we called through that list to see who was still in need of a vaccine. And we are getting ready to schedule those. So we are looking at dates in August. We have to make sure that we have the staff to work on the van and make sure that we're going to try to map these out. Again, we don't want to waste vaccine. So when we take that vaccine out, we want to make sure that we can hit a clump of folks. So we're mapping everybody that's still interested, and we will start calling pretty soon those specific clusters to schedule for one day each cluster, so that we can move about the county. Jefferson County is huge. And back when we only had a 2-hour window with Johnson & Johnson in the beginning, we had a 2-hour window once we punctured that vial. It is really hard to get across the county to make a couple of stops in under 2 hours. So we're going to try to make sure that we map that out and that we are efficient with our time and our resources. But we are going to be doing that shortly. And we're looking at dates in August.
One of the questions that I see on here, why does it say that 148,000 vaccines have been administered on the weekly information, yet only 67,000 have been vaccinated? I'm confused. Great question. Pfizer and Moderna are 2 doses. So each person that would have received that one would have gotten 2 doses. Also, we know that not everyone that received a dose in Jefferson County, like from us, were Jefferson County residents. We know that we had folks that came in from different counties and stuff. So all of that kind of evens out the number, but that's a great question. Let's see. Oh, and Julie answered that one. Thanks, Julie, for the assist. Let's see. I am going through this. I apologize for doing this one. I think I'm getting a lot of so-and-so is watching. So I think I've gone through most of the questions here. Where will we be able to find studies you were talking about with the current vaccine protecting against the Delta variant? CDC is where we are getting a lot of that information, that they have a list of studies that are directly on that page that discusses variants. And there's also another page on CDC that I cannot remember for the life of me what the URL is. But that's where they list like all of their studies. They've got everything organized. So definitely recommend checking out CDC. And FDA always updates a lot of the information with the website as well. So FDA, CDC are great locations for those. I think for the most part, that is all the questions that we had. So thank you. You're welcome. Someone said thank you for answering their question. I don't see any other questions that are coming through here. So we can kind of just recap what we've been talking about with the COVID status in the county. Obviously, we know that we're in orange this week, just a little bit over that threshold. And we know that prevention measures are key to keeping that case count low, getting us back into the yellow, eventually into green. Vaccines are out. Vaccines.gov is a great resource to find them. You can always give us a call or message us here at the health department. We're happy to get you information, answer any questions that you have. We do know that we have that confirmed case of Delta variant in the county. We know that it has a high transmission level, comes with an increased risk of severe illness. So we really want to encourage prevention measures as much as possible. It's summer. We're all maybe tired of COVID, but we still have to keep this on the forefront of our mind and make sure that we're making those choices to keep not only ourselves safe, but our coworkers, our friends, our family, and ultimately the county at large, because all of our actions play a role in that, So it doesn't look like we're getting any other questions. So we're going to go ahead and sign off for this evening. If you have any other questions, you can leave them in the comments below. We'll do our best to get to them. You can always message us or reach out on Google, Facebook, Twitter, Instagram. You can always give us a call. Our email is communications@jeffcohealth.org. We'd be happy to get you information or resources that you would need. If you have if you need information on anything COVID related, obviously you can reach the CDC site, but jeffcohealth.org, we've got a whole COVID section. You can find everything that you need as well as the links to CDC. Next episode, which is, I can't remember the date off the top of my head. It's 2 weeks from now, Wednesday. We are going to chat back to school immunizations because that is right around the corner. So we're going to be joined by some of our clinical nursing team. So we're looking forward to that one, and we'll get some information out about those questions soon. So thank you for joining us and have a good evening.